I'm Bill Pike. I'm the Director of Operations here at Trinity and want to welcome you here this evening. It's an honor to have you here. And this is our third community conversation, and this evening we have with us Dr. Danny Avula. You might know that Dr. Avula is the Director of Health for the City of Richmond and Henrico County Health Departments. And also, you probably have seen Dr. Avula in the news quite a bit recently because he has been advising the leaders in the Commonwealth of Virginia in their response to COVID-19. For the audience, this is our first evening that we've had a live audience here in the sanctuary. We're streaming this, and for the last 15 minutes of the program, we will take questions from the audience here in the sanctuary and also those who are watching at home. If you're watching at home, we would ask you to use the chat box feature. We will get those questions, and they'll be sent to us for to read. And if you're here in the audience and you have a question for Dr. Avula, we'd simply ask that you go to that microphone in the middle of the room and state your name and ask your question. Dr. Avula, we thank you for being here with us this evening. So let's get started. And just remember, relax. My old brain's not going to ask you anything that you can't handle. This is an opportunity for us to learn. But before we talk about your work, I know you have a unique story about Trinity. Do you mind sharing that with us?
I didn't know you would know that, Bill, but I guess with Mike and Teresa, you got ringers in the crowd. So the last time I was in this exact spot was just over 20 years ago for my wedding. My wife grew up here in Richmond and went to Godwin High School, and her family were members at Third, just down the street here. And we had planned to get married at Third, and some of you long-timers might remember that the sanctuary caved in at Third in the, I guess it was probably the spring of '01. And so all of the people who had weddings planned had to figure something else out. And the folks at Trinity were gracious enough to lend their space to us. Yeah. And so June 22nd, 2001, Mary Kay and I got married right here.
Right here.
It's pretty amazing.
So, yeah. So, there's another Trinity connection. You mentioned Uncle Mike. You have anything you want to say about Uncle Mike? I think he was your neighbor during medical school.
That's right.
Is that right?
So right after Mary Kay and I got married, we moved to a little brick rancher on Bronner Avenue, and really thankfully, God brought Teresa and Mike to our family. We were, kind of newly settling in Richmond as newlyweds. We were 22 and 23, and Teresa and Mike lived right across the street, and were just surrogate parents to us, right? They were just there in every way, helping us learn how to be adults, remind us when we needed to clean the yard up a little bit. They might have even come over and helped out a bunch, had us over for dinner all the time, and have just really been like family to us for many, many years. So it's a really special thing to come back and see you guys here.
I know Mike handed you a $20 bill to say all that as you came in. So
not at all. We love them. Yeah. We love the crosses.
Okay, so now we got that behind us. We can get down to business now. Okay,
that's great.
So tell us a bit about yourself, where you grew up, your interest in medicine, your education, and how you found your way to Richmond.
Yeah, so I was born in India. Mm-hmm. My dad had come to this country when he was pretty young. He was 19 or so, had finished up college, came here to go to graduate school, and subsequently joined the Navy. So he became active duty Navy here. When he decided that he was ready to get married, he called his parents up and said, "It's time." They said, "Come on home," and they arranged 12 meetings for him, 12 different women that he was supposed to spend some time with and figure out if any were going to take. And he spent an hour with the first woman, and that happened to be my mom, and he said, "I don't need to meet anyone else." And 5 days later, they were married.
How about that?
And then a few years later, had me and brought me here to the U.S. So I was probably 6 months old when I came to the U.S. originally. Spent the first 5 or so years of my life in California. And then my dad transitioned out of active duty to civilian service with the Department of Defense.
Okay.
And so we ultimately ended up in Northern Virginia by the time I was in late elementary school.
Sure.
So I I had a younger brother, 3.5 years younger than me.
Right.
We so did almost all of our growing up here. My parents were both engineers, but there is people often are curious as to why there are so many Indian physicians. But I really think that the subset of Indians that come to this country are really looking for opportunity. And so for Indian kids growing up in this country, our options are basically like IT or medicine. That's how they funnel us, right? So, and my parents were never heavy-handed about it. They were really encouraging. They wanted us. They signed us up for summer science camps. They always kind of planted the seed of us going into medicine, and apparently it worked because I'm a physician. My brother is a physician here in town. He's a family medicine doc up at Bon Secours. He's actually married to an Indian woman who's also a physician, and they've got 4 little Indian kids who will probably someday be physicians. But there's something about that, like just being raised in that community, and there were a lot of docs that were my parents' friends who were always encouraging it, who would encourage the kids to come and spend a day in the practice.
Right.
So it never felt like this is what I had to do, but it definitely, my parents did the kind of brainwashing where I thought it was my own idea, right? And it worked, and I think so that's what ultimately brought me to Richmond.
Okay.
My wife and I met at UVA.
All right.
And she had plans to go to the Peace Corps and live in the developing world at some point, and I kind of derailed those when we when we started dating, and I got into med school here at VCU. Right. So I moved here in 2000. We got married the next summer, and that was the beginning of our story in Richmond.
Wow. That's an interesting story, and it's always interesting to see how parents influence along the way, too. And I like that way you describe your parents, that they never were heavy-handed with you. They let you have some space and make those decisions. So when I take a look at all your responsibilities, and I think about all that you do with your job and your family, here's what we really need to know, is when do you sleep?
Oh, sadly not enough. I probably get 5 to 6 hours a night. I know that's not good for me. I did go to medical school. They do teach you a little bit about sleep. So I don't know. I'm probably like a 1 to 6 kind of schedule,
Right.
1 to 7.
Yeah.
Not enough.
Not enough. Yeah, I know that feeling. So I tell people that my best time to sleep is during sermons. So.
My pastor is also my best friend from college, so that wouldn't go very well.
I hear you. So, how about, can you walk us through a typical day for yourself? Like, what time do you leave home? When do you get back? And what's your schedule like during a work day?
Well, this season's been weird, right? I mean, COVID has, by and large, outside of our staff who are on the front lines, who are, going into nursing homes or actually seeing patients in clinic, right, or running the vaccine and testing events. That's primarily who's showing up day in, day out in person.
Okay.
But we've really tried to practice what we preach in terms of, so for the most of the last year and a half, I would say 70%, maybe 2/3 of the public health department have been virtual. Wow. So I will go somewhere every day depending on what's going on, but most of my day is actually done from home.
Okay.
And that certainly wasn't the case pre-COVID. I mean, I don't know that I was ever working from home before that, but that's been nice because there, especially sort of early on in the pandemic, March, April, May of 20, and then when the vaccination stuff started in January of 21, there were weeks where I was easily working more than 100 hours a week. And so to be able to do that from home and have these windows where I could still see the kids or have, grab a quick bite with them. And it allowed for a little bit more connection through what was a pretty challenging time. But right now, my day is just like Zoom meeting after Zoom meeting. Sometimes those meetings are planning meetings for what's next with vaccinations. Obviously, these last couple weeks, it's been preparation for 5 to 11-year-olds and how we're rolling out that operation. When there's a lot going on, I probably spend about 20 to 30 hours a week just doing media, whether it's, because of the statewide nature of the responsibility, there are just so many media markets who are constantly trying to make sense of what's happening and what's going on with boosters and what about these new variants and what about the surge in the other hemisphere. And so there's some part of my day is just staying caught up on what's happening because people are going to ask.
Right.
And so we've got a team of folks who are kind of paying attention to national headlines or other things. And then I have one intern who's, at any given time, I've got one person whose job it is to just like stay on top of headlines, and then we try to download about 3 times a week just so I can stay abreast of what's happening.
That's a lot.
Yeah, yeah. And then, I'll try to get to either the office or to a vaccination event just to encourage staff, see what's going on. Or, especially in this last few months of having both a state role and a local role, there have just been a lot of meetings, or, when the governor or the mayor want to do a press conference, I've got to be there to talk about COVID stuff. So it's been a weird year and a half for sure.
You're in high demand. So that's another question is, how do you balance your time between the city and the county? And how do you manage that between both localities? And plus you got the governor chasing after you too. So how do you balance all that out?
Yeah, I think part of it is just that we've developed a phenomenal team at the health department. I mean, we have such great folks at senior leadership and really throughout both organizations. And so, when the governor called in January and asked me to run point on the state vaccination effort, it wasn't easy to extract myself, but there was no question that the team could absolutely keep things running, and they have for probably 8 months before I was able to really come back in any kind of capacity. And I would say the balancing is partly that the teams are so good that the day-to-day operations I don't need to think about or worry about at all.
Good.
And so I really do prioritize making sure that I'm connected with leadership, with the county manager, with the mayor, that we're doing, that we have touch points with the elected officials to make sure that we've got our finger on the pulse of what they care about and what their needs are. And then, and so that's, really, that's probably over the last year and a half where I've had to spend most of my time in the local role.
Right.
And there, I think one of the really neat things about doing this joint Richmond-Henrico venture has been there are so many things that we, if it were another health director, they would have been doing the same things.
Sure.
And so we've been able to bring a lot of regional efforts together and kind of multiply our ability to meet needs because we're serving just a larger geographic area.
Well, you mentioned a key word there, connections. It sounds like you've got your staff in place the way you want it, and they can run the daily operations, and that leaves you free to make those important connections in the community and in the region, too. So,
yeah, no doubt.
I want to push that a little further. How do you keep your sanity in all that? I mean, what keeps you grounded? How do you work through all those things that you just walked us through? How do you keep sanity?
Yeah. I think by personality, I have a lot of capacity for chaos, right?
Sure.
I don't sit still very well. I really do need a lot of things to occupy my time and energy and brain. I also have an amazing family. I have an incredibly supportive wife, and we've got 5 kids, and that is really restorative and just like an anchor that I come home to every day. We have incredible friends and friends who are close by. We left wonderful Bronner Drive in 2004, right as I was finishing med school, to move into the East End of Richmond, and we did that with a group of friends that I've known since my first year of college, and many of them still live right around the corner, and they are an incredible support system. We meet with them regularly, we pray together, we talk together, we share each other's lives and kids and marriages and everything. So that has been incredibly helpful. And then we are part of a faith community, certainly at 3rd and East End through East End Fellowship in our neighborhood. But really, COVID has been, there's been a remarkable outpouring of people beyond our immediate circle. I can't tell you how many, there was a period of 2 months we didn't have to cook a meal. People were bringing us meals every single day at the beginning of the vaccination effort. And I got so many emails and calls and texts and handwritten messages from people who just said, hey, Thank you. We're praying for you.
Right.
And so I think there's no question in my mind about the impact of a praying community
Right.
in helping us sustain this.
We appreciate you sharing that. That's helpful to hear that. So I want to know, we want to know who your toughest boss is. Is that the mayor, the county manager, or your wife?
I don't think there's any question about that. Yeah, my wife keeps me in check for sure. I mean, and I would say this COVID season, she's been incredible. And we were talking about 2 months ago, and she just said, you know, I've seen this as a deployment, right? Like, this has been such a unique time, and I just felt like we needed to hold down the fort at home and send you out to do this mission. That's getting old, and so I do think we are talking about, like, what does it look like to find balance again, and for me to be able to kind of re-engage in
Right.
some of the rhythms in family life. But throughout my career, she has always been the one who, because I'm gonna just go chase whatever like the new exciting thing is. I love starting new things, not so great on follow through all the time. I love new ideas. I love new relationships. Like, that's what gets me going. And so because of that personality trait, there's no end to kind of the external push that I'm constantly going to be engaged in. And so she has consistently for 20 years been the person helping remind me like where I need to be and what my role is in the family first.
Right.
And I'm so thankful for it.
That's good. You gave the right answer. So when you take a look at Richmond and Henrico, and it wouldn't matter if it was collectively or separately, what is your biggest health worry for our communities?
I don't know. There's so many different health conditions that impact different segments of the community, so it's hard for one to elevate to the top. I do think one of the kind of fundamental lenses that public health brings is looking at why is it that some communities are able to, have a life expectancy to 80 years and others only 65?
Yeah.
And what is it that creates the opportunity for health? And so much of our work in public health is really grounded in creating that opportunity for health and well-being, and recognizing that that's not the same for everybody. That's not the same for people living in Gilpin Court as it is living on Bronner Drive.
Right.
And so we are constantly thinking about health disparities, why certain segments of our community, because of history, because of policy, because of access to care, because of connection, don't have the same resources.
Right.
So I think it's health inequity. I mean, really, like what I think about all the time, whether it's COVID or whether it's diabetes or whether it's life expectancy, it's how do we ensure that communities have what they need to at least have the opportunity to be healthy.
Right. Not everyone may realize this, but I know that you work closely with the school systems and student health. And when you take a look at the school systems and student health, there's a critical piece there, the school nurses. So how are school systems doing in hiring and keeping school nurses? I know we've talked about that in the past, but how's that going right now?
It's tough. I mean, schools are under tremendous, tremendous pressure right now. I mean, certainly this pandemic has, when school was canceled and everybody had to figure out on a dime how to move to virtual, that was a huge stress for school leaders and administrators. As all schools really have transitioned back to in-person learning, that's put a huge burden on school nurses, because not only are they doing their regular day jobs of administering medications, responding to acute illness, but they are also leading the charge on contact tracing and case investigation, exposure, trying to decide, what kids need to be held out of school, how many kids were actually exposed when we've identified a kid with COVID. And so it's just a ton. And so, I talk pretty regularly to both the heads of school nursing on the Henrico and Richmond side, and it's clear that they're just under so much strain. And that, for a nursing role that doesn't pay as competitively as a hospital role, it becomes hard to retain people in the midst of this. So it's a real challenge right now.
It is, and something that we need to work on. Prior to the pandemic, did you ever find yourself in a set of circumstances where you felt like just everything was conspiring against you, and you just kind of said to yourself, oh, okay, this is it. I'm out of here. If that happened, what kept you from resigning?
I really don't know that. I mean, the closest feeling that I had to that was actually in medical school. And I told you sort of the story of how I decided to become a physician, and the way that med school curriculum works. The first 2 years are all sort of classroom. You're doing the sciences. It's kind of more of what we've always done, just more focused on medicine. And then third year is when you start your clinical rotations, and you're actually doing the work of a physician, learning under attending physicians and residents. And I got through halfway through my third year of medicine, and I had done fine for the first couple of years. Didn't have any indication that this was maybe not what I wanted to do until I started to do that day in, day out clinical work.
Right.
And I just started feeling this sense that this was not satisfying. I mean, I felt like I didn't love the day-to-day clinical interactions. It was at a time, and maybe this time is still continuing, where a lot of docs out in the community were so disenchanted with the way that medicine had evolved, the control that insurance companies had, the business of medicine had really gotten in the way of practicing the art of medicine. And so a lot of physicians were just really jaded and like not inspired by their work every day. I think the med school culture can be a grind, just the early mornings, late nights, constant question asking, gruff attending physicians. But more than any of that, I think it was feeling like the way that the American medical system had pivoted to basically respond to disease, right? Like everything we were learning was how do we try to treat these diseases, and not how do we try to prevent these diseases. And that was only amplified. I'll finish that thought in a second, but that halfway through my third year of med school, I was like, this is not what I want to do for the rest of my life. And that felt like a real crisis, because it was the only thing I'd wanted to do since I was in middle school. And I actually thought about quitting medicine at that point. And thankfully, my wife just, showered with wisdom and said, listen, we've got a year left. Like, we can gut this out. It'll be fine. And then you'll have a degree, and we can at least figure out, something else. And that was great advice. And what it also forced me to do my fourth year of med school was to explore, what is somebody who doesn't want to practice clinical medicine every day? What do they do with that degree? And so my wife and I went, and we spent a month in Kenya, really exploring global health and seeing if her dream to live in the developing world could be a possibility. It turns out that I was a lot softer than I realized, and I just couldn't hack it in the developing world. And so I said, why don't we think about something else back in the U.S. It was hard. It was really, and maybe Nairobi is not the best place to explore like a career in global health. But when we got back, I ended up doing rotations with Bon Secours. They'd gotten a big CDC grant to look at community aspects of improving asthma care and asthma outcomes. And then I did a rotation at the state health department and the local health department. And that was my first exposure to non-clinical medicine. I mean, institutional kind of population health, looking at policy, looking at program, looking at other ways that we can improve health in communities. My first exposure to true public health, and I fell in love. I mean, I decided absolutely this is what I want to do with my career, and so I decided at that point. I realized at the end of my fourth year of medical school, there's actually a specialty of preventive medicine and public health. So that was the point at which it felt like everything was crumbling in my third year of med school, but thankfully, found another path.
Right, and that was going to be a follow-up question for you: is who helped you in that pursuing that degree? And clearly, your wife did.
Absolutely, yeah, for sure she did. And I remember I was whining to one of my friends from Charlottesville. He was a friend from church when I was in college who was a family physician. And I said, August, this is not what I want to do. He said, you should talk to my friend Tom. They were buddies from med school. Tom had practiced family medicine for years and kind of taken a mid-career turn to public health. And so Tom was actually the one who set me up with that rotation at the state health department. And Tom is now the public health director up in Hanover in the Chickahominy Health District. But he was the guy who was sort of my entree into this world of public health. And so there's so many people like that along the way who have just said, come on in, see what I'm doing, come hang out with me. And that invitation over and over has just been life-changing.
Built some great connections for you.
Yeah.
So in medical school, do you ever remember a professor talk in real time about a pandemic? Did they ever talk to you or teach about pandemics?
I was in med school from 2000 to 2004. In 2001, we had kind of that anthrax, the emergent anthrax event. And that resulted in a huge amount of federal funding to build up public health preparedness against the possibility of pandemics. So again, Tom Frank, his job, he had practiced clinical medicine for years, and he was now the physician at the state health department really building the emergency preparedness and pandemic response work. So that was my first exposure to conversations about pandemics.
Okay. When you came on board, advising state leaders, you've talked a little bit about this earlier, but your daily preparation for that, how intense was that? Getting ready for those meetings.
Well, in the early days, certainly, February to April of 2020, and then again with the vaccination effort, it was all-encompassing. I said I'd worked over 100 hours a week, and a lot of that was just gleaning information from every source I could so that I'd be able to convey something to leaders who were having to make decisions. And particularly when I moved into the state vaccination role in January, a huge part of my job for those first 3 months was just talking to elected officials, talking to state delegates, local elected officials who were confused, they were frustrated, they were just trying to advocate for their communities, right? Their job was to help their constituents know what was going on and advocate for getting them the treatments they needed, but they couldn't get answers. And so I can't tell you how many town halls I did for elected officials in those early months. So I had to both do the preparation and being a part of the meetings with the CDC and with the other national bodies, bring that information back and try to translate it and convey it to local and state leaders who were trying to figure out how to shepherd their constituents.
So in taking that a little step further, same type of preparation and answering those questions from the media along the way and all those press conferences?
Yeah, absolutely. In fact, for some of those seasons, it was a daily effort. I actually had a medical student who was looking for an internship. I said, I got just the thing for you. And his job, every single day, we would meet at 10 o'clock at night. We would jump on a Zoom call together, and he would have spent the day just pulling headlines, pulling interesting angles on what was happening in that 24-hour period. And we'd download from 10 to 10:30 or 10 to 11 so that I could be prepped for the media the next day.
Wow. So when the pandemic hit, there was, I think, an atmosphere of disencouragement. And you were dealing with an onslaught of setbacks, not across the state, but also in the Richmond community. In those difficult days, what gave you hope?
I think innately, just part of the way that God wired me is to be a person of hope, and I think that's just my personality, but it's also the lived experience of having been surrounded by an incredible community of friends and family and people that continue to inspire hope. I think part of the wiring to be a public health physician too is recognizing that there are, these really complex problems like how do you solve the black-white disparity in infant mortality? These are not things that I can prescribe a pill or do a surgery and fix overnight, but things that really require these complex problem-solving that happen over years and decades in some cases. And so I think that part of my nature is to focus on the positive, to think long term and to understand that like there are very few quick fixes in life.
Yeah, you're absolutely right. And but I admire people that keep chipping away at it. So when you think about COVID, one of the amazing pieces of that to me is how quickly the vaccine was created. What do you think the key was for that quick development, for that happening?
I just think it's the first time in history that we have had that much, like COVID shut the world down, right? And so there were massive economic and political incentives to figure out how to do this.
Right.
And so I don't think there's ever been a time in history where we've had as much money, as many resources, as many different companies vying for a solution globally, and as the technological advancements that we've had. And so we take like the Pfizer and Moderna vaccines as an example. They were built on this mRNA platform. Scientists have been working on mRNA stuff for the better part of 20 years, and just hadn't gotten. Like, they'd tried it with cancer vaccines, they'd tried it with Ebola and Zika, and so it was taking this technology, figuring out, okay, maybe here's a new application of this with this new virus, and then getting it done remarkably quickly.
Yeah, it really amazing when you think about it. Do you keep track of all your meetings and emails and text and all phone calls during the course of the day? Do you know how many of those happen during the course of the day for you?
I've never, it's scary. My calendar's absurd. Google Calendars keeps track of it for me. So at some point I could do a retrospective, but it's all documented in there somewhere in the cloud.
So on those days when you get a day off, what do you like to do?
Oh, they've been few and far between. I love to be in the outdoors. I'm not as a camper. I told you I'm pretty soft. I love day hiking, and I love my dogs. I've got 2 Bernese Mountain Dogs, and so I spend a lot of time with them. And then I'm a big football fan. So on a Sunday afternoon, there are a few things I enjoy as much as just sacking out on the couch and watching some football.
Yeah. Now I know your profession and your daily work requires a lot of reading, but if you had 30 minutes to read something for pleasure, what would you pick up?
Man, it's been so long since I read a book this summer, actually. My wife and I celebrated our 20th anniversary. We got away, and I read this collection of it's called 7 Men, and it's 7 stories of men who changed the world. George Washington, William Wilberforce, Jackie Robinson, by Eric Metaxas. So that's the last reading for pleasure I remember doing.
Well, that's good reading pleasure.
It was a while ago.
I hope you get more.
Thanks. It's embarrassing. July.
The pandemic's still impacting our pursuit of a return to normal. Do you think that there will ever be a return to normal?
I do. I mean, I think, I just look at how quickly people embraced wearing no masks in May when CDC changed that guidance, and how there was this window from like May to August maybe that it really felt like, okay, maybe this is happening. And then Delta variant came, and that really, I think that just felt like a gut punch for so many. But I do think that that we have to, right? COVID's not going anywhere. We know that we're going to have to figure out how to adapt to this. Vaccination is a huge part of that, but so is immunity from natural infection. I think the combination of those 2 things will ultimately result in enough people having some protection that we don't see the high death toll and hospitalization toll of this disease. I also think there are probably the next 3 to 6 months hold some promise in terms of better access to rapid testing, where people will have stuff at home, and they can, if they are symptomatic, they can just test themselves quickly and decide if they're negative that they can go on with their day. And treatments are getting better, right? We've seen monoclonal antibodies become more and more a mainstay of treatment for mild to moderate disease. A couple weeks ago, Merck submitted an EUA a request for an oral antiviral, and Pfizer is working on theirs. So there will be a time very soon where this feels like the flu in terms of severity and impact on death and disability,
Okay.
where we have treatments that keep people out of the hospital. We have the ability to identify disease early and minimize exposure to other people. So I don't know, to the degree that that feels normal, like I think that will be at least the next big step.
Yeah.
And then at some point down the road, this will just fall into the mix of kind of the regular mix of respiratory viruses that we face.
So, even before the pandemic, mental health in America was a real concern. Do you think we can rebuild our response to mental health needs in our country?
Yeah, we have to, and I hope that this is a call to be super invested in addressing that. I think, it's been particularly poignant with adolescents during COVID. I've shared this story in a few different venues, but I'm a pediatrician and a public health doc, and I still do a little bit of work at Chippenham Hospital as a pediatric hospital. So during the high times of COVID, didn't do much of this, but now that things have settled a little bit, I'm working 2 to 3 shifts a month. And it is sort of my one connection to clinical medicine. It's my one place where I actually see patients and do real doctor stuff. And I remember last November, I was back to the hospital for the first time in a long time. And we had 8 patients on the floor. 2 of them were teenagers who had attempted their own life and were recovering in the hospital. And that was, by itself alarming. But that same night in the emergency room downstairs, there were 6 more teenagers who had all attempted suicide, who were medically cleared and waiting for bed placement in a psychiatric facility, but there were no empty psych beds. Every adolescent psych bed in the state was full. And, you could just, the ER docs, the nurses, all of them were like, we've never seen anything like this. And so that for me was a moment of, the kids are not all right.
Right.
This not being in school, being disconnected from their friends, their social circles, from caring adults, was just incredibly traumatic. And I think that the impacts of that, again, they're not going to go away, just like COVID's not going to go away. We're going to have the impacts of that for a long time. And so my hope is that this, one of the outgrowths of this pandemic is a recognition of how we need to build better care models for mental behavioral health.
You're absolutely right, because it impacts us in so many different ways.
Yeah.
And so, quick questions here for what would your children say is your best attribute?
My kids probably like my goofiness. They are pretty responsive. It's a fun vibe at the Avula house.
Yeah. So, staying with your kids, when you think about their futures, do you hope any of them follow your footsteps in medicine?
I've never actually had that urging. I mean, I want them. I mean, I think one of the gifts of my career is that I've been able to do something that is it's meaningful, it makes a difference, and it integrates with my kind of worldview. And the fact that my desire to be a part of God's redemption and restoration of this world happens every day in my work in public health. That is so incredibly meaningful. So that would be the thing that I hope for my kids most, that whatever they end up doing as an occupation is also a part of their fuller vocation, their fuller existence and commitment to society.
Yeah, those are good footsteps of advice there. So, one more for you before we open up for questions from our viewers and people here. How can houses of worship assist in the work that you're doing?
As it relates to COVID response right now?
Anything.
Yeah. COVID is one season. I mean, I think maybe I'll talk a little bit about the deeper societal issues around racial inequity in terms of opportunity, health, the opportunity to be healthy, and I think that so many people ask, hey, what can we do? How do, and from my family and our lives have been changed by the decision to move into the East End of Richmond and to be in relationship with neighbors who have not come from the same places that we have, who have grown up in poverty, who have experienced, having to be on food stamps and TANF, and to try to navigate all these complex systems that we intend to help people, but often demean or really, just make it hard for people to access resources. But I think, and there are lots of complicated parts of this story, because the neighborhood we moved into with desire to have relationships with people that were not like us, that has not been all good for our community, right? We were on the front end of a wave of gentrification that led to a lot of displacement. Like, we've had a lot of, upwardly mobile, affluent neighbors who have moved in because Churchill is a cool place to be, but that has made it really difficult for low-income African-American neighbors to stay. Their rents have gone up. Longtime homeowners can no longer stay on top of property taxes. And so there's lots of complications to that. And so we've had to live with that and learn from that. And there have been lots of positives, right? Like, I'm a different kind of public health director because of where we live and who my friends are and who has shaped my understanding of poverty and the world. And it has changed our family. We have 5 children, 4 biological and 1 adopted. And our adopted daughter came to us about 4 years ago. She grew up in public housing. We met her through the community that we live in, and she's changed all of our lives. And so that is an example of, I guess, little steps to be in relationship with people that are different than us. Like, that's what I would want for the church. And, I think that it is really hard for churches, because of where they may be geographically, or the style of worship, or like what you have to wear to feel comfortable coming to a service. It's really hard for people who aren't like us or haven't grown up in that to enter that.
Yep.
And so I think to look for every opportunity to enter into relationship with people that are not like us, and then to look at what is it about our programs, our space, our services that is not making it accessible for people who are not like us to be a part of our worshiping body.
That's a really terrific observation, and it makes a lot of sense, and I appreciate you sharing that with us. We're going to open it up now for questions. Aaron, if you've got any that you want to send down, that's fine. If there's anybody here right now that would like to ask a question, please come to the microphone and give your name and ask Dr. Avula your question. Thank you. It should be on, if my memory's right. Okay.
Is it on? Yes.
Yeah.
Okay, yes. Thank you so much for being here. I believe it's your sister-in-law, Danielle, who is a physician.
That's right.
Okay, well,
Yeah.
we appreciate her so much at Crossover. She brings a lot to the table.
She sure
there.
does.
Yeah, I'm a volunteer there.
That's great.
My question is, do you anticipate an annual booster shot for COVID?
Yeah, we just had boosters approved for Moderna and Johnson & Johnson and Pfizer a few weeks before that. And those booster recommendations came on really on the tails of data that showed that, especially for the older end of the age spectrum, that immunity started to tail off at about 6 months or so. There's a lot of vaccines that we give that don't provide immunity forever and that we have to boost. And I think that's particularly true for viruses that change genetically a lot. So the reason we have a new flu booster every year is because the flu virus has all these surface proteins that change slightly, right? They mutate, they go through variations. And so the flu shot every year is trying to match whatever we see going on around the world. I think COVID is going to be a very similar scenario where we have emergent variants. It's going to continue to mutate across the world. And that scientists will try their best to find a booster every year that matches those dominant strains. So I think both because the immunity from vaccination isn't going to last forever, and because we're going to have new emergent variants, that will become a part of our annual recommended vaccination schedule.
Thank you.
Mm-hmm.
Thank you. My name is Sheila Pettigo, and I also work in the healthcare field like you do. So I have two questions for you. One is a little bit pointed. Can you share with us what is the most difficult thing about your position? And if you could change something, what would it be? That's number one, or sort of two. And the second one is, you've done a great job of talking about connection, and we talk about connection with our congregation. For someone like you that's in your position, how do you stay grounded and connect with the communities besides working with the public school district? How do you stay on the groundwork to really be connected? So number one is, what's most difficult about your job, and what could you change if you could?
Mm-hmm.
And then the second one is, how do you stay connected?
All right, the most difficult thing about my job right now in this COVID season has just been how polarizing COVID has been for our community, and having to stand in the middle of that and to try to help people understand that COVID is real, that this is a real virus that has real impacts on people, that is not some government hoax, and so restoring faith in institutions, restoring faith in science is incredibly challenging in the societal context that we're in. So that's a more sort of acute answer about what we've experienced the last couple of years, but far and away the hardest part of this response has been just how emotional people get on both sides of the issue, and having to kind of stay even and not get angry or judge or shame or belittle people, because we do have to recognize that people are they're coming from really different places on this stuff. So I'll give one quick example. Our lowest rates of vaccination are in the African American community, sort of younger African Americans, and then in white evangelicals, largely in rural Virginia. So both are doing the same thing. They're very distrustful of government. They're not getting vaccinated, but for very different reasons. And you look at Southwest Virginia, and they, not only is it, I don't trust the government shouldn't be telling me what to do, but they've also lived through this season that particularly impacted Appalachia with opioids, and the fact that these FDA-approved drugs have created untold amounts of devastation for their friends and family. And so that, and so many other examples before it, have led to this state where how can I trust what the government's telling me, especially when so much money and profit is at stake for the pharmaceutical companies. So, and then for the Black community, it is the history of public health and governmental institutions abusing African Americans, forcing sterilization, luring people into experimental surgeries, the Tuskegee experiment where we gave people syphilis and told them we were treating a disease. There's so many examples there where the African American community doesn't trust healthcare or public health. And so I guess, recognizing that people are formed by history, they're formed by what they hear from generations before them, and they're formed by their own experience, requires us to be non-judgmental and to listen well and to really try to understand what's fueling that. But it's super hard when I'm getting letters telling me that I need to resign immediately, or that I'm doing a terrible job, or that this is a huge hoax. So that has probably been the most annoying thing about the last year and a half. And then how do I stay connected or grounded to the community? I do think living, even though our neighborhood has changed a lot, many of my neighbors still are lower income African American, and as I said, we have an adopted daughter who kind of keeps us connected to this world. Every morning I drive her 3 youngest biological siblings to school. And I drive to the south side and I pick them up. They live off of Jefferson Davis, and I take them to Fox Elementary. And the reason we do that is because we know that there's inequity in schools, and that Fox, which primarily serves a more affluent white community in the Fan, just is better resourced, and there's not as much chaos in the classrooms, and the teachers have more time and energy to address issues that are going on in the classroom or at home. And we've already seen that. I mean, the attention that these 3 kids have gotten for speech delays or for like needing an IEP, I mean, that would have not ever happened in their base school, and it's happening in month 1 at Fox. And so that keeps us connected to just the reality of what people experience on the ground. And then, I think, our family really does try to stay connected to longer term neighbors in the community, and living there makes that possible.
I've got a question for you from one of our viewers at home. It says, what can be done to encourage young people to consider careers in public health?
Well, this pandemic has done a great job of encouraging careers in public health. I think even prior to COVID, actually, the public health was the fastest growing major in undergraduate institutions. And I think this has certainly just ramped up the platform that public health has had. I mean, I see that in so many aspects, just the spotlight that has been on public health. So I don't think we're going to have trouble fueling interest. What I think is going to be the problem is that we need to make sure that we have jobs for people to land in where they can actually do this work after they get the training. And we've talked a lot during this pandemic about a chronically underfunded public health system, about the need to reinvest in that. And we're starting to see this with new federal funding to build public health infrastructure. But I'm part of conversations with our state leaders about what does this look like for the future of public health. And it really means building out a public health workforce so that people who go and get public health trained have a place to land and have a place to engage in the work.
Okay. Mike?
Yep. Hi, Mike McCullough. Thank you again so much for your time. This has been a wonderful hour. Just had a quick question. Sorry about everybody's favorite subject, COVID. Curious about, we've been at Trinity sort of closely monitoring just the caseload on a daily basis, focused in Henrico County where we are. We've been sort of following the CDC guidance about sort of high or moderate or low actual transmission. And I was just curious sort of your perspectives on, I'm sure you watch those numbers every single day. It seemed like they were moving down, and perhaps they're not moving down at the rate that they were a week or 2 or 3 weeks ago. But I was curious, first of all, on sort of your impression about where Henrico may be, or currently, or what the trend may look like, what you're hearing. And then second of all, as we continue this process, do you see, or what are you observing of other organizations? Are they continuing to follow and look to sort of the CDC transmissions, or to your point about this maybe at some point becoming more endemic, are there other things that they're actually looking at when they're thinking about mitigation measures or other things that the organization should do? Thank you.
Yeah. So things have definitely been improving over the last few weeks. I mean, we've definitely seen decreases in cases and hospitalizations, and we're just now starting to see the death rates start to drop. I mean, even last week, it was about 30 to 40 Virginians we were losing every day, and that's dropped down about 20 to 30 this week. So I think, if we just follow the epidemiologic curves, that we're gonna continue to see, it's slowing a bit now, but we're gonna continue to see this downward trend, but that we've seen that there's a seasonality to this virus. And our biggest spike of disease was last December, January, and part of that is just how it's spread. We know it's a respiratory virus. When people are spending more time indoors, especially when there are higher rates of circulating disease, that's gonna lead to more cases. I'll be curious. I mean, it's going to be nowhere near as bad as last December, January, just because of both vaccination and because the Delta variant was so contagious that even if people weren't vaccinated, likely many, many people were exposed. I mean, I think we're severely undercounting the number of people who have been exposed to the Delta variant. And the good part of that is that there's going to be a high degree of immunity, again, through vaccination and then through natural immunity from infection that is going to significantly temper whatever peak of disease we see this winter. So, my guess is that we'll continue to see these blips through December, January, into February, and then as the seasonality gets better, the weather gets better, people spend more time outside. Unless there's a new curveball variant, which there certainly could be, but a lot of the national experts are feeling like Delta impacted so many people, we may not see another severe variant. That the spring would bring a huge reprieve in terms of the need for mitigation. So what does that mean for now? I think it is that we should, I think we can probably ease up a little bit on, and this isn't going to make the VDH or CDC guidance very quickly, right? I think that they're having to make guidelines for a huge swath of the population, and it's hard to do that when there's regional variability in disease rates and disease impact. But I think that, I think we want to be careful, but also get pieces of our life back. And so we have enough tools with the vaccine, with emerging treatments, with testing, that we should be able to gather much more freely. And so I think that we will see that certainly by the spring, and then depending on how much disease we see this winter, I think most people will adhere to a lot of the guidelines for the next few months, and then we'll see things ease up in March-ish.
We're going to give you one more question from folks at home. Do we think our current vaccines will be effective against the COVID variant that's coming out of England?
Yeah, so this latest emergent variant from England it comes out of the Delta lineage, this AY4.2, I think it's called, and it is becoming more of an issue. It's a little bit between 10 and 20% of the disease that they're seeing, but I think it's still too early to tell if this is going to be problematic or if it is just, it's contributing to the regular, what they would expect with the Delta variant anyway. The early returns are that the vaccine has held up for the most part, if not against infection, because people, what the Delta variant brought, and the reason why the CDC went from no masks in May to now masks at the end of July, was because the Delta variant was infecting a lot of fully vaccinated people. But the impact of the vaccine was that it was preventing hospitalization and death. So people were still getting infected, they were still able to transmit the disease, but they weren't seeing the severe consequences if they were fully vaccinated. And one of the big gaps in the data that I've been concerned about, there was actually just a CDC report that came out this week, but one of the gaps in the data had been, we just don't know enough about the impact of natural immunity and how much that protection that provides. But there was a CDC report this week that showed, and someone sent it to me this morning. I haven't got a chance to read it yet. But the headline was that people who were vaccinated were 5 times more protected against hospitalization than people who were reinfected from a previous infection. So basically, comparing vaccination versus natural immunity, vaccination was 5 times more effective in preventing hospitalizations. So there's still a huge, a huge benefit to more people getting vaccinated, and that's all I can say at this point, is that the vaccine seems to be significantly more effective even against these new emerging variants.
Okay. One final question from the audience, or are we good? Okay.
Yep, Sarah's got one.
Hi, Danny. Sarah Hall. So my family has been praying for you and for all of the scientists working on the vaccine, which, hallelujah, we got to kids. What would you suggest my family pray for in this COVID season now?
That's so kind, Sarah. Thank you. I think what are the most acute things? Certainly, our family, right? Like, I think there is a return to just family life for me and Mary Kay and the kids that we've got to figure out, because this pace of life and work is certainly not sustainable. And It's been the better part of 2 years. So definitely that. I think in the broader sense of how COVID has impacted, I mean, I just, are recognizing our role as kind of public-facing voices around this, and doing that in a way. We've got an administration change coming up. I'm not concerned about that, but clearly a changing of the parties definitely has the opportunity for lots of shifts in the way that we've been managing the pandemic response. And I just think, like, praying for wisdom about how public health professionals and our new leaders will continue to help prioritize people's health and safety, and that we will find a path out of this that really serves to bring people together and not create more division in communities.
Very good. We're going to take one last question. You mentioned the role your community of faith plays in your life. How do you balance your faith with science? What would you say to someone who claims God is in control? And so why should we mask or get vaccinated?
I absolutely believe God is in control, and I absolutely believe that God loves science and created our intellectual capacity to do these scientific things. And so those things don't feel in opposition at all to me, and I think that I've obviously seen that emerge in conservative Christians who've said we don't need the vaccine or we don't need to be treated, and I think we just need to remember that, like, we are all reflections of Him with our intellect, with the advancements in technology, and that we should embrace that. We should embrace those God-given things that have changed our society for the better.
Well, we want to thank you, Dr. Avula, for your time this evening. It's been an honor to have you with us. We've learned a lot. We appreciate your leadership and all that you're doing to help our communities. And so we thank you because we know all that you're trying to do and all that you're working through. And so I hope you get some sleep.
Thanks, Bill.
To our viewers, we appreciate you being with us tonight, and we encourage you to come back on Tuesday, December 14th. That's when we'll have a couple of special guests from United Methodist Family Services. We'll have Nancy Toscano, their President and Chief Executive Officer, and Jill Gaynor, their Annual Giving Officer, and we're going to learn all about United Methodist Family Services. As we close out, I want to thank the Trinity staff for all their help in helping us put this event together, and all the people that work behind the scenes, and that goes to Aaron Miller, our Modern Worship Director, who's handling all the technology. And got a special pass tonight from a professor in seminary that allowed him to be here. So we need to send some brownies or something good to that professor for helping out Aaron this evening. Also want to thank our communication person, Kim Johnson, for all the work that she does behind the scenes to help us too. So, and thanks for those of you who are here this evening. Thank you for those who watched at home. We hope you have a good evening. Stay healthy and stay safe. And Dr. Avula, thanks again.